Welcome to the updated Dr. Bernstein podcast. Please check the description for the original sources, and all content is general in nature and should not be considered medical advice.
Okay.
Today, we're doing a deep dive
Okay.
into some really interesting research that we found on PubMed, and it all has to do with type 1 diabetes and mental health.
It's interesting.
Yeah.
This is an area that's gaining a lot of traction.
Yeah.
Just to give you an idea, like back in 2002,
Okay.
PubMed only had one article
Wow.
that was published on depression and anxiety in youth with type 1.
Okay.
Now jump ahead to 2024.
Yeah.
There were 13 articles published in just that year.
Wow.
So you can really see how the focus is starting to shift
Yeah.
towards a more holistic understanding of diabetes management.
Right. So it's not just about the numbers.
Exactly.
It's about the whole person.
Yeah.
Their emotions and their mental well-being.
Their mental health. Yeah.
Now, before we get too far into the research, I think it's good to kind of recap what Dr. Bernstein's perspective is,
Sure.
which a lot of our listeners are already familiar with.
Yeah, a lot of people know Dr. Bernstein.
Yeah?
He's pretty famous for advocating a very strict low-carb diet and a tight blood sugar control regimen.
Right.
And he's really trying to mimic
Yeah.
the blood sugar patterns of someone who's non-diabetic.
Right. And he's spoken quite a bit
Yes.
about the emotional benefits of stable blood sugar.
Yeah.
He often talks about how
Yeah.
if you minimize those blood sugar swings,
Yeah.
it can lead to
Greater emotional stability.
Yeah.
Yeah.
and an overall improvement in quality of life.
Exactly.
So that's kind of where we see some interesting parallels
Yes.
with the PubMed research.
Yeah.
One of the things that we saw in a lot of studies
Yes.
was a link between glycemic control
Yes.
and mental health
Mm-hmm.
in individuals with type 1.
Right. Like one study found that 30% of youth with type 1 experience depressive symptoms.
That's a really significant number,
It is.
much higher than in the general population.
Yeah.
And that same study
Okay.
highlighted how those heightened depressive symptoms were often correlated with less effective glycemic control.
Exactly. It's like what Dr. Bernstein's talking about, the
Yeah.
importance of stable blood sugar.
Exactly.
But the research goes even deeper than that,
Okay.
into a bunch of other factors that can influence
Okay.
mental well-being in people with type 1.
Like what kind of factors?
Well, you see studies on family dynamics.
Yeah.
You see social support,
Okay.
diabetes, distress, and burnout,
Right.
even the effects of COVID
Wow.
on people's mental health.
So Dr. Bernstein's giving us like a foundation.
Yeah.
But the research is saying we need a bigger picture
Yes.
to really understand and address the mental health needs
Yeah.
of individuals with type 1.
Yeah. It's like Dr. Bernstein gives you one piece of the puzzle. Yeah. But the research really helps you see the whole picture.
Yeah, with all of its complexity.
Exactly.
Okay, so let's unpack some of those complexities.
Okay.
One thing that really stood out to me
Yeah.
was research on the mental health of parents
Yes.
and how that can impact children with type 1.
Yeah, this is often overlooked.
Yeah.
And one study from 2021 found that parental mental health
Okay.
can actually predict emotional distress
Wow.
and HbA1c levels in adolescence a year later.
That's a really powerful finding.
It is.
It's suggesting that if a parent is struggling,
Yes.
it can make it harder for their child to manage their diabetes.
Exactly. It highlights how interconnected
Yeah.
family well-being and diabetes management are.
Right.
And to give you some numbers,
Okay.
a 2023 meta-analysis showed that over 22%
Wow.
of parents of children with type 1
Yeah.
experience depression or depressive symptoms
Probably.
globally.
That's like 1 in 5.
It is 1
Yeah.
in 5, and that really emphasizes the need for more support
Yeah.
for families navigating this condition.
It's like a ripple effect.
It is.
The parent's well-being influences the child's well-being,
Yeah,
which then affects their ability to manage their diabetes.
right. So we can't just focus on the individual. We have
Yeah.
to think about the whole family system.
And that's where we see a little bit of a divergence
Yes.
from Dr. Bernstein's approach.
Yeah.
He emphasizes patient empowerment
Yes.
and self-management.
Right.
But the research suggests that sometimes
Yeah.
individuals and families might need more.
Yeah.
than just knowledge and willpower.
More than just knowledge and willpower, yeah.
To succeed, they might need additional support,
Yeah.
resources and intervention,
Exactly.
tailored to their own situation.
Right.
So it's about finding that balance
Yeah.
between individual responsibility
Yeah.
and acknowledging that sometimes people need extra help,
Yeah.
especially when you're dealing with the emotional weight of diabetes.
Yeah.
And speaking of emotional weight,
Okay.
let's talk about diabetes distress and
Right.
burnout.
Mm-hmm.
These are concepts that
Yeah.
Dr. Bernstein doesn't really address,
Right.
but the research really dives into it.
It does.
So diabetes distress and burnout.
Yeah, these terms really capture
Hey, we-
the emotional burden that can build up over time when
Yeah.
you're constantly having to think about blood sugar
Right.
and make dietary choices and manage insulin.
So it's like the mental fatigue
Exactly, the mental fatigue.
of diabetes management.
A 2021 study really highlighted this,
Oh.
explaining how diabetes distress is different from general anxiety
Right.
or depression.
Okay.
It's specific.
Yeah.
It's tied to the worries and anxieties of living with diabetes.
Okay.
So it's things like guilt,
Yeah.
frustration,
Mm-hmm.
anger,
Right.
emotions that can be really difficult to deal with.
And this study also looked at diabetes burnout,
It did.
which is like you just hit a wall.
Yeah.
You're emotionally exhausted.
You just can't keep up anymore.
Right. You just can't muster the energy
Yeah.
to keep up with diabetes management.
And it can look different in different people.
Okay.
It could be neglecting self-care,
Yeah.
feeling hopeless about the future,
It's
even
a-
feeling disconnected from your healthcare providers.
So the motivation to manage diabetes effectively just disappears.
Yeah, it just fades away.
And the research shows that both of these
Yeah.
are linked to poorer glycemic control
Mm-hmm.
and increased risk of complications.
Yeah. This is where I think the research goes beyond Dr. Bernstein.
Right.
Because tight blood sugar control is important.
Yes.
But we need to think about how to address these emotional challenges
yeah.
as part of diabetes care.
It's like Dr. Bernstein gives us the blueprint
Yeah.
for the physical stuff.
Yeah.
And then the research tells us about the emotional architecture
Yeah. I like that. That's a good analogy.
that we need to build alongside.
Yeah.
So let's talk about the research
Okay.
that's exploring specific interventions
Mm-hmm.
for managing mental well-being
Yeah.
in type 1.
Yeah, there's an explosion of new ideas and
Right.
approaches.
I'm excited to hear about this.
Yeah.
This is stuff that our listeners can really use.
Yeah, this is the practical stuff.
Yeah.
So what kind of interventions are we talking
Yeah.
about?
Well, there's a lot of interest in things like yoga
Okay.
and painting therapy
Okay.
as potential tools
Right.
for supporting mental health
Yeah.
in people with type 1.
And what's the research saying about this?
It's actually looking pretty promising.
Okay, great.
One study focused on yoga therapy,
Okay.
and it was delivered virtually
Okay.
for managing depression in adolescent girls with type 1.
Okay.
And they saw a significant reduction in depression scores
Compared to like a control group?
compared to a control group. Yeah.
Right. Okay. So it seems those simple, accessible practices can be really powerful
Yeah.
for mental well-being.
Yep.
And there was another study that looked at painting therapy,
Okay.
and this was also delivered virtually.
Interesting.
And this one focused on anxiety and depression
Okay.
and self-efficacy
Okay.
in children with type 1.
I think it's interesting that
Yeah.
both of these studies
Yeah.
used virtual platforms.
Mm-hmm.
It seemed like that could be really valuable,
Yeah.
especially for people who have a hard time
Yeah.
accessing in-person therapy.
It could be a game changer.
Yeah.
So did they find anything?
Yeah. So the results were really positive.
Okay.
The painting therapy group
Okay.
showed significant reductions
Wow.
in both anxiety and depression levels.
That's great.
Yeah. And it suggests that having those creative outlets can be a really healthy way
Yeah.
to process emotions and cope
Yeah.
with the challenges of diabetes.
It's about addressing the whole person,
Right.
not just their blood sugar levels.
Right. And the research also explores some of the psychological nuances of type 1
Yeah.
that go beyond traditional diagnoses,
Right.
like depression and anxiety.
Okay.
One example of that is alexithymia.
Alexithymia.
Have you heard of this?
Yeah, I have.
So alexithymia is
Yeah.
difficulty identifying and expressing emotions.
So they have trouble putting their feelings into words.
Yeah.
Okay.
And they might not even know what they're feeling.
Oh, wow.
A 2019 study
Okay.
looked at this in
Yeah.
individuals with type 1,
Okay.
and they found that alexithymia was
Yeah.
linked to
I-
a greater likelihood of depression,
Okay.
poor glycemic control,
Wow.
and abdominal obesity.
So not just an emotional issue. It's
Yeah.
physical, too.
Yeah, it can impact
Yeah.
physical health.
Yeah. It seems like it can hinder effective diabetes self-management.
Yeah. Right, because it's hard to make healthy choices
Exactly.
when you don't know what you're feeling or
Right.
what your body needs.
And that can then lead to poorer control.
Yeah, and then that increases the risk of
Yeah.
complications.
It's a chain reaction,
Yeah,
starting with difficulty processing emotions
right.
and ending with long-term health problems.
Yeah, and this emphasizes the
Mhm.
importance of emotional awareness
Right?
and expression.
Yes.
And that's something that Dr. Bernstein
Yeah.
doesn't really address
He doesn't.
in his work.
Right. So Dr. Bernstein focuses on empowering people
Right.
to take control of their blood sugar
Right.
through knowledge and self-discipline.
Yeah, but the research is suggesting
Yeah.
that emotional intelligence
Yes.
might be another key
Yeah.
to successful management.
So it's like he gives us the technical manual,
Yeah,
and the research is adding the human element.
exactly.
And that human element
Yeah.
includes understanding that diabetes
Can affect people
Yeah.
in different ways,
Mm-hmm.
depending on their age
Mm.
and their life stage.
That's a good point.
Yeah.
Are there any studies
There are.
that highlight those differences?
There's one that focused on emerging adults.
Okay.
So these are people who were diagnosed in adulthood.
Okay.
And the study found that
Mhm.
this group screened positive for diabetes distress
Okay.
more often
Yeah.
than people who were diagnosed in childhood.
Well, that makes sense.
Yeah.
But getting diagnosed as an adult is
Yeah.
really challenging.
It is.
Suddenly you have this chronic condition that
Mhm.
you need to manage.
And it requires big lifestyle changes.
Yeah. And for a lot of emerging adults,
Yeah.
this diagnosis comes at a time when
Yeah.
they're going through a lot of life transitions,
That's it.
like starting a career or forming new relationships.
Yeah. So adding diabetes on top of that
Right.
can be really overwhelming
So healthcare providers need to be really aware. Yeah.
of the needs of this group.
Yes, they do.
And there's a 2023 study
Okay.
that looked at
Mhm.
different support programs
Okay.
for youth with type 1 and their families.
Okay.
And it focused on two approaches.
All right.
One was general,
Okay.
and one was specifically for diabetes.
So a diabetes-specific
Yeah.
program.
Yeah.
Yeah.
So, Kim, which one was better?
Well, the study found
Oh,
that both programs were actually helpful
Oh.
for improving glycemic control and reducing diabetes distress.
So even general support can make a difference.
Yes, even general support can help.
Wow.
But the diabetes-specific program was better
Okay.
at reducing depression symptoms.
So having that specific understanding and empathy can
Yeah.
really make a difference with
Yes.
this kid. Yeah.
Yeah. It shows the importance
Yeah.
of personalized care.
Right. We can't assume one size fits all.
Right.
We have to look at the individual, their circumstances and their needs.
Their age, their situation.
Right.
Yeah.
And it's not just about providing support.
Mm-hmm.
It's about empowering people
Yes.
to manage their condition.
Yeah.
And that's something that Dr. Bernstein
Yeah.
really emphasizes.
He does.
But the research shows
Yeah.
that empowerment
Yeah.
might need to look different
It might.
for different people,
It might.
depending on their support system.
Right. And there was one study
Okay.
that looked at the role of parents
Okay.
in diabetes management for teenagers.
Okay.
And they found something surprising.
Okay, what's that?
More parental involvement
Okay.
in things like blood glucose monitoring
Mhm.
and insulin administration
Yeah.
was actually linked to worse glycemic control.
Really?
Yeah.
That's so surprising.
I know you would think more
Yeah.
involvement would be better,
Right.
but the researchers think
Yeah.
that too much involvement
Yeah.
can actually prevent teenagers. Right.
From developing
Yeah.
self-efficacy
Yeah.
and independence.
Right.
So it's a delicate balance.
It is.
Parents want to help,
Yeah.
but sometimes letting go
Yeah.
can actually be more empowering.
So how do you find that sweet spot?
It's all about communication and collaboration
Okay.
between the healthcare providers,
Right.
the parents,
Yeah.
and the teenager with diabetes.
It's about finding that balance
Mm-hmm.
where the parents are supporting and guiding,
Yeah.
but also encouraging the teen to develop skills
Yeah.
and confidence to manage things on their own.
And this all connects to the bigger idea
You're right.
of patient-centered care,
Yeah.
which comes up a lot in the research.
So what does that mean?
It means recognizing
Yeah.
that individuals with type 1
Yeah.
are the experts
Right.
on their own bodies and their experiences.
Right.
So instead of just telling them what to do,
Right.
healthcare providers should work with them.
To come up with a plan
Yeah,
that meets their needs.
right. It's about respecting the patient's autonomy
Exactly.
and empowering them to make their own decisions.
Yes.
And that includes acknowledging their emotions
Yeah.
and their psychological needs.
Yeah. It's about creating a space
Yeah.
where they feel comfortable talking about their anxieties and their fears.
Because at the end of the day,
Yeah.
successful diabetes management
Yeah.
is not just about numbers.
Right.
It's about helping people live full lives.
It is.
And that means
Yeah.
taking care of both their physical and emotional well-being.
Yes. And this reminds me of a 2018 study
Okay.
that looked at the long-term impact of depression
Okay.
on people with type 1.
And what did they find?
They found that depression
Yeah.
significantly increased the risk of
Wow.
dementia later in life.
Wow. That's pretty serious.
They're intertwined.
Especially with type 1.
Yes, especially with type 1.
And this study raises an important question.
Okay, what's that?
Could addressing the things
Yeah.
that link depression and dementia
Yeah.
actually reduce the risk of both?
That's a great question.
Yeah. And it's something that researchers are looking into.
Yeah.
So there's still a lot that we don't know.
There is.
But this research shows
Yeah.
how important it is
Yeah.
to consider mental health
Right.
as a key factor in long-term diabetes management.
Absolutely.
So Dr. Bernstein gives us a good foundation
Who does?
for blood sugar control.
Yeah.
But the research tells us to
Mhm.
broaden our perspective and
Right.
take a more holistic approach.
Yeah, an approach that includes
Yeah.
both physical and mental well-being.
So it's like Dr. Bernstein gives us the tools
Yeah.
to build a strong foundation,
Yeah.
and then the research helps us see
Yeah.
the intricate details that
Mhm.
need to be built on top of it.
I like that. That's a really good way to put it.
It feels like we're seeing a
Yeah.
real change
Yeah.
in how we approach type 1 care.
A paradigm shift.
Yeah.
Yeah.
So let's bring it back to our listeners.
Okay.
What can they take away from all this
Yeah.
and apply to their own journey?
Well, I think one of the biggest takeaways is the validation that managing diabetes
Yeah.
is about so much more than just numbers.
Mm-hmm.
It's about recognizing that your mental health is just as important
Right?
as your physical health.
Right. It's okay to acknowledge
Mhm.
that this is hard,
It is.
that there will be good days and bad days.
It's a roller coaster.
Yeah. Don't be afraid to ask for help.
Yeah, reach out to your doctor,
Yeah.
talk to a therapist.
Find a support group.
Yeah, there's no shame in asking for help.
Right.
In fact, it's a sign of strength.
Exactly. And remember,
Yeah,
you're not alone in this.
you're not.
The research shows that this is really common
Yeah, it is.
among people with type 1.
Yeah, and
Yeah.
having that support system can really make a difference.
So if we had to kind of sum up
Right.
what we've learned today from
Yeah.
both Dr. Bernstein and the research,
Yeah.
what are the big takeaways for our listeners?
Well, first of all,
Yeah.
both Dr. Bernstein and the research agree
Okay.
that stable blood sugar is key
Yeah.
for both physical and emotional well-being.
So if you're feeling moody,
Yeah, if you're feeling emotionally reactive,
yeah.
take a look at your blood sugar.
Right. Talk to your doctor
Yeah.
about refining your management plan.
It's about finding what works for you,
Yeah.
whether that's through diet
Like,
or medication or more frequent monitoring.
it's about finding that personalized balance.
Exactly.
Okay. What else?
So Dr. Bernstein really focuses on self-management.
Yeah.
But the research highlights the importance of a support system,
Right.
family, friends.
Healthcare providers
Yeah, even connecting with other people. Yeah.
who have type 1.
Right. It's about knowing
Yeah.
you don't have to do this alone.
And sometimes asking for help
Yeah.
is the best thing you can do.
Exactly.
And finally,
Yeah.
Dr. Bernstein gives us that foundation
Mm-hmm.
for blood sugar management.
Okay.
But the research tells us to look beyond the numbers
Right.
and think about the emotional side of things.
Right.
So pay attention to diabetes distress,
Mm-hmm.
burnout.
Yeah.
Find healthy ways to cope,
Right.
like
Yeah.
yoga.
Yeah. Painting.
Some mindfulness.
Right. And find ways to express your emotions.
Yeah.
So it's about creating a diabetes management plan
Yeah.
that supports your whole self.
It is.
Mhm.
Body, mind, and spirit.
Right. And remember,
Yeah.
self-care is not selfish.
No, it's not.
It's essential
It is.
for your well-being and for managing your diabetes effectively.
It's about shifting
Mhm.
from managing a disease
Mm-hmm.
to living a full life.
I love that.
Yeah.
That's what we want people to take away.
I like some of this deep dive.
We've covered a lot today,
We have.
from Dr. Bernstein's classic approach
Mhm.
to the latest research on type 1 and mental health.
And we've seen how these two perspectives
Yeah.
kind of work together
They do.
to give us a
Yeah.
better understanding of this
And for a
condition.
more holistic understanding.
Yeah.
Yeah.
And we hope this knowledge empowers you
Yeah.
to take an active role in your health.
Yeah. Be your own advocate.
Exactly, both physically and emotionally.
Knowledge is power.
It is.
The more you understand,
Yeah.
the better choices you can make.
Right. So as we wrap up,
Okay.
we want to leave you with a thought.
Okay.
If research is showing that a holistic approach is better,
Mm-hmm.
how can you integrate mental wellness
Yeah.
into your diabetes management routine?
Even small steps
Yeah.
can make a big difference.
Right.
And remember, there are resources out there.
Mm.
Talk to your healthcare team.
Yeah.
Connect with other people with type 1.
Right.
You're not alone.
You're not alone.
No.
Thank you for joining us on this deep dive.
Thank you for listening.
Remember to like and subscribe, and thank you for listening.